2-year-old female presented with developmental delay. I'm showing you sagittal T1 weighted, axial T2 weighted, and coronal T2 weighted brain MRI scans. Describe the findings.
Right. So, the brain MRI demonstrates complete agenesis of the corpus callosum with no callosal fibers or tissue identified. On the axial T2 scan, there is increased separation of the lateral ventricles, which are parallel and have a bat's wing appearance. The occipital horns are disproportionately dilated compared to the frontal horns, demonstrating mild colpocephaly. The coronal image demonstrates elevation and upward herniation of the third ventricle between the widely separated lateral ventricles. There is no surrounding vasogenic edema or mass effect on these images.
I am showing you axial brain CT images from a different patient. What do they demonstrate, and what is the differential?
The comparison brain CT scan demonstrates similar features with widely separated, parallel lateral ventricles, showing a classic bat's wing configuration. There is also colpocephaly with prominence of the posterior horns and a high-riding third ventricle. The differential diagnosis includes corpus callosal dysgenesis, partial agenesis, and acquired corpus callosum destruction, secondary to perinatal ischemia. Ischemic destruction typically spares the rostrum or genu, but results in thinning and focal volume loss, whereas developmental dysgenesis follows a strict embryological order.
Explain the embryological development of the corpus callosum and its relevance to distinguishing these conditions.
The corpus callosum develops embryologically between the 12th and 20th weeks of gestation. It develops in a strict front-to-back direction, starting with the genu and body, followed by the posterior body and splenium. The rostrum is the final part of the corpus callosum to develop. In primary developmental dysgenesis, the splenium or rostrum is absent while the genu is present. Conversely, in perinatal ischemic injury, the rostrum is present but thinned and atrophic, indicating secondary destruction rather than developmental failure.
What other congenital central nervous system abnormalities are associated with corpus callosal agenesis?
Agenesis of the corpus callosum is frequently associated with other midline anomalies and neuronal migration disorders. Associated features include midline lipomas, interhemispheric arachnoid cysts, Dandy-Walker malformations, and Chiari malformations. Cortical dysplasia, gray matter heterotopia, and schizencephaly are also commonly seen in these patients. Prenatal detection can be made using obstetric ultrasound or fetal MRI from 22 weeks gestation onwards.
Discuss the clinical presentation, prognosis, and how you would manage this patient as a radiologist.
Clinically, patients can be asymptomatic or present with developmental delay, intellectual impairment, or infantile spasms. As a radiologist, I would recommend a high-resolution brain MRI to evaluate for associated neuronal migration disorders like heterotopia or polymicrogyria. I would also recommend screening for syndromic associations like Aicardi syndrome in females with chorioretinal lacuna. Finally, I would recommend referral to pediatric neurology and developmental pediatrics for clinical support and occupational therapy.